All right. Hello, Mr. Jones. Hi, my name's Terry, and I am your LPN today. It looks to me like you're having a little trouble here getting some oxygen. Your O2 sats are a little low. Can you try coughing for me? Okay, that's not helping, huh? All right, well, I can help you out a little bit by suctioning out that trach, okay? Can you tell me your name and date of birth? Perfect. All right, I will be right back. I'm going to gather some supplies, okay? All right. I'm grabbing my trach care and some normal saline solution here. And I have my stethoscope. I'm going to listen and see what's going on inside those lungs. So I do have a face mask and a shield on. It's COVID, and so we always have to have those things on these days, not just for suctioning and those kind of cares, but in every care we do. So I'm going to do some hand hygiene, and then I'm going to listen to his lungs. All right, I need you to take some nice deep breaths, okay? Good. Okay, very good. All right, I need you just to lean forward for me for a second here so I can listen to your lungs and your back. Okay, nice deep breaths. Here we go. Okay, you can lay back down. Okay, I'm documenting in my head here what his O2 sats are, and then also checking his respiration, seeing what those are sitting at, and then I'm going to put him up in a high Fowler's position, but as you can see, my table is not as good as a hospital bed would be, so we're going to do this for the video here so that you can see what's going on, okay? So the first thing I want to do is do some more hand hygiene. And I'm going to that up. And then I'm going to open up my supplies here. Those set up. Put up my normal saline solution. And then I'm going to check my suction, make sure that that's working. So I'm going to turn it on and feel, make sure that it's going good. It is. So I'll just set that aside there and shut that off. So I know that that's good. And then I'm going to put on my first sterile glove here. Taking it by the cuff. And then I'm going to set up my sterile field. Stuff together here. Okay. And then I'm going to put the things only that I need to do this skill inside there. So I need my other glove, and I need to have this cup, and then the tubing here. Okay. So then with this hand here, I'm going to pour a little saline solution in there. Okay. And then I'm going to get ready to suction my patient. So apologize for the whining there. Get that underneath the cuff there. Put on my second glove. And now both of my hands are sterile at this point, but I'm going to use this one and contaminate it as I go ahead and hook up the tubing here. Okay, and I'm going to turn on my suction between 80 and 120 and just kind of make sure that it's working here. I'm going to stick it in there and yep, it's working. So, okay, Mr. Smith, I'm going to go ahead and suction you out here a little bit. This will help you breathe a little bit better, okay? Got the oxygen. Keeping my thumb up, I'm going to put the tubing down until I hit resistance. And then once I hit resistance, I'm going to turn my hand side to side and pull it out. Put his oxygen back on. I'm going to wait about 30 seconds, and while I'm waiting, I'm going to clean this out a little bit. Okay, 30 seconds has gone by. His O2 sats are looking a little better, but not quite where they should be. So, Mr. Smith, I'm going to go ahead and do that again, okay? Okay. This shouldn't take any longer than 10 seconds to pull that out. Put that in there. Again, I'm looking at his sats and they're looking really good now. Are you feeling better? Able to breathe a little bit better? Okay, perfect. All right. I'm going to shut off my power over here, disconnect my tubing, and I'm going to roll this up in here and get rid of all this stuff into the garbage. Don't need that for anything else. And then I'm going to do some more hand hygiene. And then I'm going to reassess him. Put on some clean gloves here and do another reassessment. I'm going to listen to those lungs again in the front and in the back. Do his respirations again, making sure that everything sounds better. And then when I'm done with all of that, make him comfortable, give him his call light, and then document my findings.